Like, share, comment, and subscribe for more updates. Welcome to a modern dialysis center, a place of routine and resilience for many. As patients arrive for their life-sustaining treatments, a hidden danger often goes unnoticed, one that silently threatens their mobility and overall well-being. For patients receiving chronic hemodialysis, the risk of developing a diabetic foot ulcer is a serious and frequently overlooked complication. In the complex landscape of managing end-stage renal disease, the primary focus is often on fluid balance, blood pressure, and dialysis adequacy. This means the early subtle signs of foot problems can be missed by both patients and clinicians. Yet the consequences are profound. These ulcers significantly increase morbidity, leading to recurrent infections and prolonged, costly hospitalization rates. They are a major contributor to mortality in this vulnerable population and drastically reduce quality of life, often leading to chronic pain, loss of independence, and social isolation. But this outcome is not inevitable. Thanks to dedicated evidence-based research, we now have a clear, actionable framework to shift from reactive treatment to proactive prevention. A pivotal 2023 study by Dr. Vasid Asik Ozdemir and Dr. Nezrin Nural provides the scientific foundation for this new standard of care. Their research was born from a critical need to understand why this specific patient group is so susceptible. It sought to meticulously identify the key risk factors and, from that evidence, establish effective preventive strategies tailored specifically for the unique challenges faced by hemodialysis patients. Conducted within a Turkish university hospital, their work represents a rigorous, focused investigation into a global health issue. The study's strength lies in its comprehensive approach, combining direct patient interaction with detailed clinical evaluation. Using structured questionnaires and comprehensive clinical assessments, the study confirmed that a powerful combination of factors creates a high-risk environment. The researchers identified 4 major contributors. First, diabetes, which impairs the body's ability to heal. Second, peripheral neuropathy, a nerve-damaging condition that robs the feet of sensation, meaning injuries can go completely unnoticed. Third, underlying peripheral vascular disease, which reduces blood flow, starving tissues of the oxygen needed for survival and repair. And finally, poor foot hygiene, which can create the perfect entry point for infection. Together, these factors form a dangerous cascade toward ulcer development. Based on this powerful evidence, a multifaceted preventive care bundle can be implemented in any dialysis unit. This isn't about adding more work. It's about integrating smarter, targeted actions into the existing workflow. Here's what evidence-based practice says we must do. First, conduct regular and thorough risk screenings. This begins with a comprehensive baseline foot exam upon admission to the dialysis program. Crucially, this is followed by routine checks at each and every dialysis session. These checks should be systematic. Use a 10-gram monofilament and vibration testing to assess for loss of protective sensation. Palpate for pedal pulses and check skin temperature to evaluate circulation. Visually inspect for any redness, calluses, or breaks in the skin. This consistent vigilance is our first line of defense. Next, we must empower patients with structured education on daily self-inspection and hygiene practices. This goes beyond simply handing them a pamphlet. Teach them to use a long-handled mirror to check the bottoms of their feet daily for any changes. Instruct them to wash their feet with lukewarm water, dry thoroughly, especially between the toes, and to apply a quality moisturizer to prevent cracking, while always avoiding the areas between the toes where excess moisture can foster fungal growth. This daily ritual is a powerful tool for early detection. Third, protective footwear is absolutely critical and non-negotiable for high-risk patients. Ensure patients have properly fitted, supportive shoes with soft cushioned insoles and a deep, roomy toe box that doesn't cramp the toes. Emphasize that they should never walk barefoot, even at home. Socks are just as important. They should be seamless, preferably made of a moisture-wicking material, and without tight elastic bands at the top that could constrict already compromised circulation. Fourth, manage comorbidities aggressively. Foot health is a direct reflection of systemic health. This means collaborating with the patient and their primary care team to achieve tight glycemic control, as high blood sugar levels directly impair healing and nerve function. It also requires diligent blood pressure and lipid optimization to protect vascular health. For patients who smoke, providing robust, empathetic, and persistent smoking cessation support is essential, as smoking severely constricts blood vessels. Finally, and perhaps most importantly, foster seamless multidisciplinary coordination. Preventing foot ulcers is a team sport. The nephrologist, dialysis nurse, podiatrist, primary care physician, and wound care specialists must work from a single shared care plan. This ensures clear communication, timely referrals for issues like callus removal or nail care, and consistent follow-up, closing any gaps where a patient might otherwise fall through the cracks. This isn't just theory. It's evidence-based practice in action. By integrating these 5 pillars into our daily operations, through standing orders, chairside checklists, and automated prompts within the electronic medical record, we create a safety net. We transform care from a reactive model that waits for a wound to appear to a truly preventive one that stops it from ever forming. The urgency of this preventive work becomes clear when we consider the alternative. If a diabetic foot ulcer is not prevented or cured, it can lead to a cascade of devastating complications. It can cause a severe infection of the skin and underlying tissue. This infection can spread to the bone, a condition called osteomyelitis, which is a major risk factor for amputation. If blood flow is insufficient, the tissue can die, leading to gangrene. This progression may ultimately result in the amputation of a toe, the foot, or even the entire leg. In the most severe cases, an untreated infected ulcer can lead to sepsis, a life-threatening systemic response to infection, and, tragically, death. Every ulcer we prevent is a life we protect from this catastrophic chain of events. So let's recap the action plan. This is a simple, powerful checklist for every dialysis unit. 1. Implement daily patient self-checks and routine nursing foot inspections. 2. Ensure all at-risk patients have and use appropriate protective footwear. 3. Aggressively manage glycemic control and other comorbidities. 4. Establish clear lines for multidisciplinary follow-up. And 5. Use tools like checklists and electronic medical record prompts to make this the standard of care for every patient, every time. By taking these concrete steps, we see the real-world impact. Patients who remain mobile, independent, and free from the pain and risk of ulceration. Every step protected is a life improved. Thanks to the diligent work of researchers like Dr. Ozdemir and Dr. Nural, we now have a clear life-changing roadmap to protect dialysis patients from the devastating impact of foot ulcers. By embracing this evidence, we can empower our colleagues, educate our patients, and fundamentally change outcomes, one step at a time. Thanks for watching. If you found this information valuable, please like, share, comment, and subscribe for more. Share this video with your colleagues to raise awareness and help implement these vital practices in your own clinical setting.